If you're over 60, there's something in your daily routine that could quietly be raising your risk of a stroke while you sleep. No warning, no pain. 1 minute, you're reading a book or chatting with your grandchild, and the next, your arm won't move, your words won't come, or your balance disappears. And here's the part that breaks my heart. It's not because you've been careless. Many of the older adults I've treated over the years were doing everything right. They exercised, ate well, avoided alcohol, and still found themselves waking up to the horror of a stroke. Why? Because of one overlooked habit, taking certain vitamins at the wrong time, in the wrong dose, or without understanding how your body changes after 60. You may be thinking, but they're just vitamins, they're natural, they're supposed to help. That's what everyone thinks, until they don't. The truth is, as we age, our kidneys, our blood vessels, and even our nervous system become more sensitive. What once nourished us at 40 can quietly harm us at 70, especially during the night when your blood pressure shifts, your organs rest, and your body is most vulnerable. But don't worry, I'm not here to scare you. I'm here to show you how to protect yourself. In today's video, I'll walk you through 9 common vitamins that may quietly increase your risk of stroke, brain bleeds, or nerve damage. And more importantly, I'll show you what to do instead, naturally, safely, and wisely. So please, watch this video to the end, because I promise you, there's a moment coming that may completely change how you look at your morning pill routine. It may even save your life. Before we dive in, let me ask, do you take any vitamins or supplements daily? If yes, comment the number 1 below. If not, comment 0. Your answers help me make better, safer videos just for you. Now, let's begin. Because your brain, your beautiful aging brain, deserves the truth. Number 1, vitamin D, the silent artery hardener. The bone protector that can quietly raise your risk of stroke while you sleep. You've probably been told that vitamin D is essential for strong bones, especially as you age. And that's true. In moderate doses, it helps your body absorb calcium, strengthens bones, and supports immunity. But here's what almost no one tells you. Too much vitamin D, especially taken daily and at night, can harden your arteries and quietly set you up for a stroke. Let me tell you about a man named Walter. Walter was a 74-year-old retired Navy veteran. He walked every day, cooked his meals, and didn't smoke or drink. Every morning, he took a 10,000 IU capsule of vitamin D. He thought he was doing the right thing, protecting his bones and joints. But one morning, his wife found him slumped on the couch. His arm was limp. His words were jumbled. His blood pressure had spiked in the night. It was a stroke. When we ran his labs, his blood calcium was dangerously high. His arteries had become stiff and fragile. The culprit? Vitamin D toxicity. You see, vitamin D is fat soluble. It doesn't wash out easily like vitamin C. It builds up over time. And once there's too much in your body, it drives calcium into your bloodstream, not just your bones. That calcium then gets deposited into your arteries, making them rigid, brittle, and more prone to clot. Now add in the natural drops and spikes in blood pressure that happen while you sleep, and you've created a dangerous storm inside your body. Most seniors don't realize this. They take 5,000 to 10,000 IU daily, far beyond the safe amount. Unless your doctor has diagnosed you with a deficiency, you only need 600 to 800 IU a day, and always in the morning, not at night. Walter survived, but he now walks with a limp. He can't drive. He told me something I'll never forget. I thought I was protecting myself. I didn't know I was setting a trap inside my own body. So my plea to you is this. Only take high-dose vitamin D if your doctor tells you to. Get your blood tested regularly. Take it in the morning. And remember, after 60, more is not better. It's riskier. Number 2, vitamin E, the natural blood thinner that can cause brain bleeds. the heart-friendly antioxidant that could quietly lead to bleeding in your brain. Vitamin E has long been marketed as a hero for your heart. You've probably seen it on bottles claiming to support circulation, memory, and even skin health. For many seniors, it seems like a safe, natural choice. But what if I told you that this very supplement could quietly thin your blood to the point where it causes a hemorrhage inside your brain? That's exactly what happened to Evelyn. Evelyn was 81 years old, a retired librarian who adored her daily routine: tea at 2 p.m., crossword puzzles, and a daily dose of vitamin E. She took 800 IU every day, believing she was helping her heart. But Evelyn also had a heart condition and was prescribed warfarin, a blood thinner. Her doctor carefully monitored her medication, but she never mentioned vitamin E. One evening, she developed a severe headache. She became confused, then began vomiting. At the emergency room, a brain scan revealed the cause. She had suffered a hemorrhagic stroke, bleeding inside her brain. Not from a fall, not from high blood pressure, from blood that had become too thin to clot. Most people don't know this, but vitamin E in high doses acts as a natural anticoagulant. It makes your blood less likely to clot. That's fine, until you're also taking medication that does the same thing. The result can be deadly. Here's what's even more concerning. The recommended amount of vitamin E for older adults is just 15 milligrams a day, which equals around 22 IU. Yet most supplements on the shelf contain 200, 400, even 1,000 IU per capsule. There are no warning labels, no pharmacist standing beside you at the store to say, well, be careful. Evelyn told me later with tears in her eyes, I just wanted to take care of my heart. I didn't know I was making my brain bleed. That's the tragedy. She didn't do anything reckless. She was trying to protect herself. So if you are taking blood thinners like warfarin, aspirin, or Plavix, you must talk to your doctor before adding vitamin E. Even if it's labeled natural or heart healthy, that doesn't mean it's safe in every situation. And remember, bleeding in the brain is not like a regular stroke. It often leaves more lasting damage. There's no second chance. Number 3, vitamin B6. The nerve support that can quietly damage your nervous system. The supplement meant to protect your nerves could be the very one destroying them. As we age, it's common to experience numbness, tingling in the hands or feet, or slight balance issues. Many of us assume it's just a part of getting older, so we reach for nerve support supplements, the ones that claim to boost energy, improve focus, or strengthen nerve health. One ingredient you'll often see on the label: vitamin B6. But here's the hidden danger. In high doses, vitamin B6 isn't just ineffective, it's toxic. Let me tell you about Harold. Harold was a 76-year-old retired truck driver. After years on the road, he wanted to take better care of himself. He bought a supplement online called Neuromax Nerve Defense. It promised sharper focus and stronger nerves. The label said doctor formulated and safe. Each tablet had 100 milligrams of vitamin B6. Harold took 2 a day, every day, for more than a year. Then he began falling. At first, it was subtle, a misstep, a stumble. His fingers started tingling. Sometimes he couldn't grip his coffee mug. He thought it was arthritis or old age. But when he fell in the shower and hit his head, he came to see me. His tests came back normal: blood sugar, heart, even brain scans. But when we reviewed his supplements, I immediately saw the problem. He was taking 200 milligrams of vitamin B6 every single day. That's 10 times the safe upper limit for older adults, which is no more than 20 milligrams a day, including what you get from food. Unlike water-soluble vitamins that flush out quickly, vitamin B6 builds up in your body. And when it does, it damages the protective covering around your nerves, a condition known as peripheral neuropathy. Think of it like fraying the insulation around a wire. The signal weakens, and eventually it fails. We stopped the supplement immediately, but the damage was done. Harold never fully regained his balance. He uses a cane now and moves more slowly. He told me, "Doc, I just wanted to stay sharp. I didn't know I was poisoning myself. And he's not alone. Many nerve support supplements on store shelves contain 100, even 250 milligrams of vitamin B6 per dose. Some combine it with other stimulants or untested herbs. There's no clear guidance and no pharmacist to warn you. So here's the truth. If you're experiencing nerve symptoms, numbness, tingling, balance trouble, don't assume you need more B6. That may be exactly what's causing the problem. Check your labels. Add up the milligrams. And if you're taking a nerve support product, bring it to your doctor, because sometimes the help we think we're giving our body is the very thing that's hurting it most. Number 4, vitamin A, the eye vitamin that raises brain pressure. The nutrient known for vision support that can quietly raise the pressure inside your brain. For years, vitamin A has been praised for its role in protecting your eyesight. Eat your carrots, we were told. And there's truth in that. Vitamin A supports the health of your retina and helps you see in low light. But what many people don't realize is that too much vitamin A, especially from supplements, can quietly increase the pressure inside your skull, leading to vision problems, headaches, and even brain damage over time. Let me introduce you to Margaret. Margaret, age 79, loved gardening. She had a sharp mind and perfect memory, but her vision had begun to blur, especially in the evenings. She assumed it was normal aging. She didn't want to burden anyone, so she searched online and started taking a high-dose eye health supplement. Each capsule had over 10,000 IU of preformed vitamin A, listed as retinol palmitate. She took it daily for 6 months. Then came the headaches. They started mildly. A dull throb in the evening. Then came dizziness. One day, she lost her balance while walking in her backyard. Her daughter brought her in. A brain scan showed elevated intracranial pressure. Fluid was building up inside her skull, compressing her brain. Her eyes showed signs of swelling at the optic nerve. The diagnosis? Pseudotumor cerebri, a condition that mimics a brain tumor in symptoms, but is often caused by excess vitamin A. You see, unlike beta-carotene, the plant form of vitamin A that your body converts as needed, preformed vitamin A builds up silently in the liver. It doesn't flush out easily. Seniors are especially vulnerable because their liver function and metabolic rate naturally decline with age. Margaret was lucky. We caught it early. She stopped the supplement, received treatment to reduce pressure, and her symptoms slowly improved. But not everyone is that fortunate. Here's what you should know. The safe upper limit for preformed vitamin A is around 3,000 IU per day. Many supplements far exceed this, and some multivitamins for seniors still use the more toxic retinol form instead of beta-carotene. So if you are taking an eye supplement, read the label. Look for beta-carotene instead of retinol or retinol palmitate. Avoid doses over 3,000 IU unless your doctor specifically prescribes it. And remember, blurry vision, dizziness, or persistent headaches are not just part of getting older. They may be your brain trying to send a signal before something worse happens. Number 5, niacin vitamin B3, the cholesterol fix that spikes stroke risk, the heart health vitamin that can dangerously raise your blood pressure and trigger mini strokes in your sleep. If you're over 60 and trying to manage cholesterol without relying on statins, you might have heard about niacin, also called vitamin B3. It's promoted as a natural way to lower LDL and raise HDL, the so-called good cholesterol. It sounds like a gift, right? But here's the truth. When taken in high doses, especially without medical supervision, niacin can silently become a ticking time bomb, spiking your blood pressure, causing sudden dizziness, and even triggering mini strokes during your most vulnerable hours, early mornings or while you sleep. Let me tell you about Frank. Frank, 83, a retired postman from Florida, had always prided himself on staying active and avoiding medications. He walked daily, played cards with friends, and kept up with health trends. When a friend told him about a natural cholesterol vitamin he found online, Frank bought it immediately. It contained 1,000 milligrams of niacin per tablet. He took 2 per day for nearly a year. At first, he joked about his niacin glow. His face would flush bright red after each dose. But over time, he started waking up feeling like his heart was pounding out of his chest. One morning, while reading the newspaper, his speech slurred. It lasted less than a minute. He dismissed it until it happened again, this time with numbness in his left arm. Tests confirmed it. Frank had suffered 2 transient ischemic attacks, or mini strokes. His cholesterol wasn't even dangerously high. The culprit? Niacin. Here's what's happening. High-dose niacin causes blood vessels to dilate rapidly. That's the flushing. Then they rebound and constrict, sharply swinging your blood pressure. For older adults, whose vascular systems are more sensitive and less flexible, this fluctuation can be deadly. Even so-called flush-free or extended-release niacin forms aren't risk-free. Extended-release types can damage the liver. Flush-free versions may not help your cholesterol at all, but still interfere with medications or spike blood pressure. The recommended amount of niacin for seniors is around 14 to 16 milligrams per day. Yet many supplements give you 1,000 to 2,000 milligrams per tablet, up to 100 times the daily need. Frank thought he was doing the right thing. "Doc," he said to me, "I just didn't want to be on pills the rest of my life." But he nearly lost everything trying to avoid a prescription. So if you're over 60, trying to manage cholesterol, and see a supplement with niacin in large doses, don't go it alone. Always talk to your doctor. Number 6, vitamin K, the hidden stroke trigger in your greens and multivitamins. The essential vitamin for clotting becomes risky when mixed with the wrong medication. Vitamin K plays a vital role in your body. It helps your blood clot properly. Without it, even a small cut could lead to dangerous bleeding. That's why it's often praised in health communities, especially for maintaining bone strength and cardiovascular health. But here's what many people over 60 don't realize. If you are taking a blood thinner like warfarin, too much, or even too little, vitamin K can send your blood balance into chaos. And in some cases, it can trigger a stroke. Let me share the story of Doris. Doris, 77, had been taking warfarin for years after a minor heart procedure. Her dosage was carefully adjusted by her doctor, and her blood levels were stable. But then, she joined a health challenge group that encouraged green smoothies and added multivitamins. She started drinking kale and spinach smoothies every morning. She added a multivitamin labeled Complete for Seniors, and without realizing it, she tripled her vitamin K intake in less than 2 weeks. Then it happened. She developed a sharp pain in her chest and shortness of breath. Her daughter rushed her to the ER. Doctors found a clot in her lungs, a pulmonary embolism. Her blood had become too thick to flow properly. When we reviewed her diet and supplements, the issue was clear. The sudden surge of vitamin K had interfered with her warfarin, reducing its effect. Her blood became more likely to clot. Vitamin K itself isn't bad. It's essential. But when you're on anticoagulants, the key is consistency. Your body adjusts to a regular level. Sudden increases or drops confuse the system and can create dangerous swings. And here's the part that shocks many. Multivitamins labeled senior-friendly often include vitamin K. Even if you're on blood thinners, they don't always warn you. So what should you do? First, never start or stop a vitamin K-rich supplement without speaking to your doctor. Second, keep your diet steady. Don't suddenly start juicing large amounts of greens or stop eating them completely. And finally, if you're on warfarin, make sure your doctor knows everything you're taking, including over-the-counter pills and natural products, because your blood is a delicate balance. And even healthy foods or vitamins, when taken without care, can tip the scale toward danger. Number 7, folic acid, the memory masker that can hide vitamin B12 deficiency. the brain vitamin that can quietly allow nerve damage to progress undetected. If you're over 60, you've probably noticed how quickly your mind reacts to the slightest memory slip, misplacing keys, forgetting a name, repeating a story. Many of us silently worry, is this normal aging or something more serious? In that moment of fear, it's easy to reach for a supplement promising to protect memory and prevent dementia. And among the most common ingredients, folic acid, vitamin B9. Folic acid is crucial for brain development and red blood cell production. It supports DNA repair and cognitive clarity. It sounds perfect, right? But here's the hidden danger. Too much folic acid can hide a deficiency in vitamin B12, one of the most important nutrients for your brain and nervous system. And when B12 deficiency is masked, the damage continues quietly until it becomes irreversible. Let me introduce you to Thomas. Thomas, 74, was a retired history teacher from Michigan. Passionate about books and politics, he had a sharp mind and a sharper memory until recently. He began forgetting facts he once lectured on. He stumbled over simple words. His wife noticed he was becoming more irritable and withdrawn. Fearing early dementia, Thomas started taking a high-dose brain support supplement he found online. It contained 1,000 micrograms of folic acid, over twice the daily recommended amount. He felt slightly better for a few weeks, but then came the numbness in his hands, the unsteady steps, the inability to focus. When he came to my clinic, he was terrified. We tested his blood. His B12 levels were dangerously low, but his red blood cell count appeared normal. Why? Because the folic acid was masking the signs. His brain, however, was already under assault from the deficiency. You see, vitamin B12 is essential for maintaining the protective sheath around your nerves. When levels drop, your nerves begin to degrade, leading to confusion, tingling, memory loss, and balance problems. And once that sheath is gone, damage can be permanent. The worst part, folic acid won't fix B12 deficiency. It may delay diagnosis by covering up the most obvious signs in blood tests. This isn't rare. Older adults often have reduced stomach acid, take medications like metformin or acid reflux drugs, or have digestive conditions that impair B12 absorption. If they're taking folic acid on top of that, they may never realize B12 is missing until their nervous system is already damaged. So here's the bottom line. If you're over 60 and taking a supplement with folic acid, ask your doctor to check your B12 levels, and not just the basic blood test. Ask for methylmalonic acid, MMA, and homocysteine levels, which more accurately reflect cellular function. Because protecting your memory isn't about taking more, it's about taking what your body can use. Number 8, vitamin C, the immune booster that can harm your kidneys. The popular cold fighter that may quietly form kidney stones and damage aging kidneys. For generations, vitamin C has been seen as a harmless helper. When a cold hits, we reach for orange juice, chewable tablets, fizzy powders, believing it boosts immunity, shortens illness, and protects our cells from aging. And for the most part, in small doses from food, that's true. But here's the hidden danger. In high supplement doses, vitamin C can silently turn into oxalates, sharp crystals that form kidney stones and damage your kidneys over time, especially after 60 when kidney function begins to naturally decline. Let me tell you about Robert. Robert, 72, was a retired firefighter. Strong, independent, still helping his neighbors with yard work, he prided himself on never getting sick, so he took matters into his own hands. Every day he drank a fizzy vitamin C powder mixed in water. Each packet had 1,000 milliliters of ascorbic acid. Sometimes he took 2. Then one day, the pain hit. It started in his lower back, sharp and stabbing. He couldn't sit, couldn't walk. He ended up in the emergency room, curled up, sweating. A scan revealed the cause, a kidney stone the size of a marble. But that wasn't all. The doctors also noticed reduced kidney function, an early sign of chronic kidney disease. Robert was shocked. He didn't have diabetes or high blood pressure. He hadn't taken painkillers. What had caused it? His daily megadose of vitamin C. Here's what happens. When your body breaks down excess vitamin C, it converts it into oxalate, a waste product that leaves your body through urine. But if oxalate levels become too high, it crystallizes, forming stones. And those crystals can also lodge in the kidney's tiny filters, causing inflammation and long-term damage. What's worse, kidney damage from oxalates often has no symptoms at first. You won't know until the damage is advanced. For healthy adults, the recommended daily amount of vitamin C is about 75 to 90 millias. Yet many supplements contain 500, 1,000, even 2,000 milligrams per dose. Some powders suggest taking them multiple times a day. And here's the thing, your body only absorbs what it needs. The rest becomes waste, or worse, damage. So if you're over 60 and take vitamin C supplements, choose wisely. Stick to low-dose options unless your doctor advises otherwise. Get your C from fruits and vegetables, like bell peppers, strawberries, and broccoli. And stay hydrated to help your kidneys flush waste naturally, because your kidneys, silent and loyal, deserve to be protected, not punished by what you thought was helping. Number 9. Multivitamins. The dangerous cocktail when you're over 60. The one pill solution that could quietly create a storm inside your aging body. It's easy to see why multivitamins are so popular. One little tablet promises to cover all your nutritional bases: energy, immunity, bone health, brain support, heart protection, all in one. But here's the truth nobody tells you. As you age, the same multivitamin that once helped can now hurt because your body doesn't process vitamins the way it used to. Your kidneys filter more slowly, your liver metabolizes differently, your gut absorbs unevenly. And yet most multivitamins still deliver the same adult dose, regardless of your age, weight, or medical conditions. Let me tell you about Irene. Irene, 85, was a retired teacher from Ohio. She believed in prevention. Every morning, she took a multivitamin for women over 50. She drank plenty of water, ate healthy, walked, stayed sharp. But one day, she fainted in the garden. Her blood pressure had dropped. She was severely dehydrated. But something else caught my eye in her labs. Her calcium, iron, and vitamin A were all elevated. Not dangerously high, but enough to explain her dizziness, confusion, and heart rhythm changes. The cause? Her multivitamin. It turns out even senior-friendly formulas often include iron, vitamin A, retinol, copper, and high-dose B6 and E, nutrients that can accumulate and cause harm after age 60, especially if kidney or liver function has declined. Iron overload can damage the liver and heart. Too much vitamin A can raise brain pressure. Excess copper may affect memory. High B6 can harm nerves. Even a little extra calcium in the bloodstream can confuse the heart's rhythm. Individually, the doses seem small, but together, every single day, they add up, especially when combined with other supplements or fortified foods. Multivitamins are not evil, but they're not benign either. And for older adults, personalization is key. Here's what I advise my patients. Don't assume senior labels mean safety. Bring your multivitamin bottle to your doctor or pharmacist. Ask which ingredients you truly need and which to avoid. Consider switching to individual supplements based on blood tests, not guesswork. And if you're eating a balanced diet, you may not need a multivitamin at all. Because your needs after 60 are different. What helped you in your 40s could quietly hurt you now. Your body deserves a plan made just for you, not a one-size-fits-all pill. 10. Vitamin D. The sunshine pill that might cause heart rhythm problems. The bone-strengthening superstar that can disrupt your heartbeat when taken in excess. Vitamin D has become the darling of modern health advice, especially for older adults. It's credited with strengthening bones, boosting immunity, lifting mood, and even protecting against cancer. Doctors prescribe it, friends recommend it. It's everywhere. But there's one thing we don't talk about enough. Vitamin D is a fat-soluble vitamin. It doesn't flush out like vitamin C. It builds up. And when levels get too high, especially in those over 60, it can cause calcium to flood the blood, leading to irregular heartbeat, confusion, and even kidney problems. Let me tell you about Alan. Alan, 81, was a retired dentist. Sharp, active, and always reading medical articles. When he saw a news report linking low vitamin D to COVID complications, he decided to double his dose. Without telling his doctor, he went from 1,000 IU to 5,000 IU per day. For a while, he felt great. But then came the muscle twitching, the heart flutters. One afternoon, while gardening, his chest tightened. His wife called 911. At the ER, his heart rhythm was unstable. Labs showed dangerously high calcium levels, but not from his diet. It was from too much vitamin D. His body had started pulling calcium out of his bones and pouring it into the bloodstream, overwhelming his heart and kidneys. Doctor stopped the supplement. It took weeks to rebalance. Alan now takes a tailored dose under supervision. Here's the key. Vitamin D is powerful, but more is not better. The recommended dose for older adults is usually around 800 to 2,000 IU per day, depending on blood tests. Yet many people take far more believing it's harmless. But when vitamin D levels exceed 100 nanomolar in the blood, it can trigger hypercalcemia, a condition where calcium builds up in the blood, leading to confusion, nausea, irregular heartbeat, kidney stones, or worse. You can't feel your vitamin D level. You need a blood test. And if you're also taking calcium or magnesium, the effects compound. So please, get your vitamin D tested yearly. Don't take high doses unless advised by your doctor. And remember, sunlight, even just 10-15 minutes in the morning, is still the best natural source. Because your heart doesn't need megadoses, it needs balance. If you've stayed with me until now, thank you. That alone means you care. Not just about living longer, but living clearer, stronger, and wiser. Today, we uncovered the hidden risks behind 10 common vitamins, not to scare you, but to empower you. Because after 60, your body changes, your needs evolve, and what once seemed helpful could quietly become harmful if taken without care. But here's the good news. Knowledge is power. And now that you know, you can make smarter choices, not based on trends, but on truth, not from fear, but from understanding. So please, take this knowledge and share it. Help someone else avoid a mistake they didn't even know they were making. And if you're wondering what else could be silently putting your brain and your life at risk, there's a fruit that many seniors eat every day, believing it's healthy. But under the surface, it can quietly raise your stroke risk after 60. In the next video, I'll reveal exactly what that fruit is, why it affects aging brains, and how to eat smarter without fear. Watch it here. This fruit raises stroke, risk after 60, click subscribe. I'll keep showing you what most doctors won't. And comment below. Have you had any surprising reactions to vitamins or supplements? Your story might help someone else. We're in this together. Because aging wisely starts with asking better questions and never settling for easy answers.